Hi, my name is Jason Salemi. I'm an associate professor of epidemiology at the University of South Florida College of Public Health, and I've developed a statewide COVID-19 dashboard that has pretty granular data on cases, testing, hospitalizations, death, vaccinations, variants, kind of you name it. If I can get my hands on it, I try and bring that information to the public and other stakeholders. And I get a lot of media interviews, primarily that are very data centric. And because Florida has gotten a certain reputation for data, I'm often asked, how do I know I can trust the COVID-19 data in Florida? And so in a lot of these articles, I'm quoted on how much I trust the data coming out of the County Department of Health and the State Department of Health. And so I wanted to just take a few minutes to explain why I say I trust the data and why it really does matter to me. So, first of all, I don't really know what's going on behind the scenes with the data. I don't work for the Florida Department of Health. I don't work for the Department of Health and Human Services or the CDC, all of whom I extract data from. I don't collect my own COVID data. I'm not funded to do so. I rely on information that is collected and reported by others. And of course, I don't have any access to raw or confidential data, only what is made publicly available by these different entities. And so that I need to say up front, I don't really know the truth. You see my little Alexander Hamilton screenshot there. That's from, I wasn't in the room where it happened, right? So I don't know what actually happens behind the scenes. So how can I say I still trust these data? And again, just to be very clear, all of the information from my dashboard comes from downloading information from the Florida Department of Health, from the Department of Health and Human Services, from a bunch of different PDFs from which I extract data, from the Agency for Healthcare Administration in Florida for some of the hospitalization data, from the CDC. So again, I'm downloading information that other people collect. But I would argue that my site is not derivative. It is not similar to what the Florida Department of Health or the feds make available. And that's because what I try and do is present information in a way that is more beneficial to people. So, whereas this might just be your normal epidemic curve, I do allow people to drill down by a combination of county and age groups and gender and whether or not somebody is a resident or by the date that they became a new case. And I also have, when you hover over this epidemic curve, you get a lot of calculated information. Again, it's not new information, but I'm trying to bring new metrics, calculated metrics to light so people don't have to do calculations on their own. I also focus on methodological issues down at the bottom left. This is showing the lag in reporting over time for deaths. I try and bring information that is, again, made available by the Department of Health on vaccinations at the county level and by age. But again, I try and take it from a PDF and bring it to life by showing you county-specific maps that are also age-specific on vaccination rates. You hover over this, you get more information. Or as an epidemiologist, I try and make county-level comparisons on things like deaths more comparable by doing age-adjusted death rates. So again, I am not collecting any new information. The information that I present does rely on other entities, but again, I try and present it in a way that adds to the usability or the granularity of the information. So the second big point is I do really care about the information that I am choosing to make available to the public, really as my service as an epidemiologist and a public health professional. I don't feel like I can just pass the blame. Oh, well, I didn't create the data. It's on the Department of Health. I'm choosing to present these data, and so I should take some due diligence in vetting the data to the extent possible. And the big point about all of this is if I really thought there was a problem, not just with the data in general, but with any particular data element, I would immediately not present that data. Why would I present data that I think are inaccurate or are misleading? And so how are some of the ways that I try and vet the data? Well, I'm not bashful. I ask a lot of questions. This is just a screenshot from an email that I sent last September where I saw an anomaly when we first started to see the feds report on hospitalizations. And this was specific to pediatric hospitalization rates in Florida, and it just didn't make any sense with everything else that was being reported, Florida compared to other states. When I looked at the data, I didn't just upload it to my dashboard and display it. I try and see if it makes sense, and this particular thing did not make sense to me. And so, I am a steward of the data, and so I try and assist all of the entities that work very hard to make the data available. And so when I reached out to them, you can see the responses down at the bottom. It says, however, based on your comment, we reviewed our pediatric calculations and did find an issue. It has been corrected. So this is great, right? And since then, the data made sense. So I do ask questions, and it's my service also to these entities to help them to correct any issues. It's an inordinate amount of data that they're trying to compile and report on. I do try and dig deeper. This is just an example for excess deaths. You hear a lot of talk about that. I don't just display the information that's on the CDC website or try and compile it and make it look pretty. Behind the scenes, even though I don't make it available on my dashboard, I do try and dig deeper. These are just some basic examples. So I try and compare the percent excess deaths that are reported by states to the percent of all deaths that were attributable to COVID-19 versus something that is not COVID-19. Again, just looking for anomalies. Does Florida or any other state stand out in an odd way? And so in this particular analysis, Florida seemed middle of the pack. I'm also looking at states that tend not to report information on certain weeks. Does Florida stand out? In this case, for reporting, Florida is complete up until the most recent week. Some states like North Carolina haven't reported the last 15 weeks of provisional death data, and so we would have to take their excess death calculations with that context in mind. And again, this is just another example. This is weekly all-cause deaths. This is, what they might call a lava plot. At the top left is Florida. At the bottom right is the United States. And I'm just looking to see, does anything not make sense for the lag that we're seeing as new weeks roll out, or does Florida look like other states or look like the nation as a whole? And so when I do find things, so, like this is an example from an article that came out on the left-hand side, and they were reporting that the IHME had come out with these new calculations and these new estimates, and whether you trust their methodology or not, the point of this was, oh my goodness, the death toll in Florida is 41% higher than what the state records show. And so the important thing is not to just look at numbers in isolation. We need to do comparisons, because when we compare, this was a story about the same kind of topic on the right by NPR in which I was interviewed. And my point was just to say, yeah, every state, or just about every state, has underreported COVID-19 deaths. There are good reasons why that has happened. And Florida is actually 16th lowest among all states. So again, this is not to vilify any state or absolve any state. It's just we do need context when we look at the data. And so I try and say, okay, if there's something that this data is imperfect, which all of the metrics on COVID-19 are imperfect, does Florida, because that's my responsibility, is trying to report on Florida, does it stand out egregiously? Is there something that we can't trust? Because I want to make people aware of that and certainly pull that metric down from my site. And the other major thing that I do, so I think a lot of people have noticed this article from the American Journal of Public Health that came out on the left. This was singling out Florida, investigating their excess deaths, and suggesting that Florida, again, was underreporting. And so I felt as though there were big methodological flaws in the data that were used to make this case. And I also thought, again, you isolate a single state, you don't provide context, that context is deserved. And so I don't just rely on me talking to the media. I want my criticisms, my critiques to be formal. I want them to be peer reviewed, even if it is just a critique. And so I wrote a letter to the editor immediately. As soon as I read this paper, I submitted it immediately. And you can see down at the bottom right, although it takes them a while to make these published papers available, this letter to the editor, where I am sharing my concerns about this paper, was accepted for publication. It won't be published, unfortunately, online until mid-June, it looks like. But, I try and get this so that people can look at my criticisms, critique them, and decide on whether or not they feel they are warranted and valid, and whether the journal wants to publish that alongside the original article. And so, again, I'm trying to take every effort I can to make sure that the data are vetted to the extent possible. I can't look at the raw data. Again, I can't review death certificates. I'm not trained to look at it as though a medical examiner would and say, are we classifying deaths correctly? But I am trying to exert my due diligence. And of course, the last thing is I really would just like to express gratitude. We often criticize, people who work at the county health department, the state health department, the Agency for Healthcare Administration, the federal government. It is a challenge to collect all of these data, vet them every day, even though there are automated processes. I have the same thing for my dashboard. I have a lot of automated processes to extract all of these data, but I could just simply upload them every night and it would probably take me 15 minutes. But it takes me about 2 hours every day because as I download each different data source, I at least look at it. I look to see if there's anything that's anomalous because I want to be able to send an email or not display a certain element or at least let people know. And especially since I'm not on social media anymore, that's become much more challenging. And so, again, I just want to say thank you. I've been a consultant with the Hillsborough County Department of Health trying to look at their reports, make them better. And I just value the work that's been done. My dashboard would be absolutely meaningless and impossible if Florida didn't make certain data sets available at a certain granularity. And so, anyway, this is just my take. Again, I don't know the truth. I do, though, try and vet the data to the extent possible. And for everything that I've seen, comparing to national resources, I just feel as though the data that I receive from Florida and that I make available and that you see on multiple dashboards, I do feel like they give us a relatively accurate representation of where we are in the pandemic, and certainly tracking those trends over time give us an assessment of whether or not we're doing better or worse. So this ended up being way longer than I wanted it to be, but I just thought I'd get that out there and share my thoughts. And again, as always, I'm happy to hear from you. So thanks, and I'll talk to you soon.